I just want to say I think it's a very important event. You're just sitting here listening to those wonderful examples. It is motivating, and it is good to see how people are taking forward these ideas so innovatively and so creatively. But it's important because I think as we're 1 year on, it's a good time to take stock of where we are, where we go next in translating the philosophy of putting people first and putting it into everyday practice. I think it's also an important time at this point because with some tough times upon us economically that you'll all be aware of, I think the principle of personalisation is more important than ever. And I hope, well, I doubt there's any person in this group who would question the transforming power of personalisation, not least when we hear some of the excellent examples there. But I do think it is transforming the lives of service users, and that's first and foremost what we're all about here to achieve. I'm going to give a couple of my own examples as well, because I've been going around the country and meeting lots of people. I met a lady when I went to Essex to meet the Essex Coalition Disabled People. I think I'm speaking later today, and met the people who work there. But this is a lady, and she used her individual budgets to buy an oxygen compressor. And what that did, it freed her from all the travel constraints that were being imposed by her condition, which is why she required oxygen. Another guy, Ben, that I met there, and he was using his individual budget to pay for a personal assistant who takes him to the theatre and to the cinema, which are two of his big passions. And my favourite individual budget story, this time not from Essex, is a retired gentleman who's got mental health problems, and he used his budget to buy a dog. And it got him out of the house, it got him meeting people, it rebuilt his confidence, and it rebuilt his links with the community. And I have to say, I think his partner also found it helpful that he got out of the house a bit more and gave her a bit of a break. I had to say, I'm not one for regional stereotyping, but the fact that this guy happened to be from Yorkshire and the dog that he bought happened to be a whippet kind of stuck in my mind. My apologies to anybody from Yorkshire. But what really stuck in my mind was how it worked incredibly well for everybody concerned. And by giving him the choice, giving him the power to decide what would make the difference to his own life, it was quite clear the individual budget transformed his outlook, it helped him to reduce his dependency on other forms of support. Basically, it improved the quality of his life. I have to say also, it saved the council some money in the long run, and it gave that good old a loving home in the process. I just want to say too, so those are a couple of my examples, as long as those you've been hearing earlier today. Personalisation can be just as transforming, just as life-changing for carers as well. Research has shown that individual budgets are helping to reduce their stress, to improve family relationships and their wider well-being as well. Last year's carers strategy is designed to build on all this suggestion. I mean, I think too often in the past, carers have been neglected. We've got 6 million odd people doing vital work with their families, their friends, and the community. But I don't think we do give carers the recognition and support they deserve. And I hope the carer strategy is changing that, putting that right. But I think we do need to push on in terms of giving carers the right help, and help that's personally responsive to their needs, as carers help that works for them and not the organisation providing it. Again, I think that's another key to the vision of putting people first. And let's not forget that personalisation is also transforming a third important group, that's namely us. All of us in this room, transforming the way that we think, we operate, the way we work together. And I think that process is really exciting, really very rewarding. But I do know it can also be extremely difficult. And I think it's a big challenge because throughout organisations it can mean the really fundamentally rethinking about the service planning we do, the management we do, the delivery of the services for which we're responsible. And I say to you, that's a challenge that we can't ignore. I don't think we can say this is too difficult, let's put it to one side. I think if we are set, as I'm sure we all are, on the goal of improving standards in social care, then this is a journey that we have to embark upon. And I have to say to you, I think that it's a challenge that is even more important, not less important, in these rather more difficult economic times. I do think we shouldn't repeat We mustn't repeat the mistakes we've had previous downturns. I think the time is right to step in, not step aside. I think we do have to be fair, not laissez-faire in our approach to supporting the most vulnerable. So for me, right now, this raises the bar for all of us in this room. Tougher times will actually mean that more people will be looking to us, looking to local government, looking to local services for the help, the support they need. I think people will be expecting more from you, from us, demanding more from every pound that you spend on their behalf. Levels of scrutiny will rise, and therefore, so must our performance. In other words, I actually think this is a moment when, as you've been hearing today from some of those presenting, excellent local services must come into their own, when we must shine out what we're doing, not retreat back into the shadows. And especially when the idea of pushing power and choice down to the level of the individual, this is a time when that should blossom and flourish, not wither or die. And 1 year on, far from applying the brakes, I think now is the time for us to step on the gas when it comes to personalisation. Certainly, the investment is there to help you to do just that. £520 million in total has been earmarked for personalising social care. 85 million has already gone into the system this year. Another £195 million is now coming on stream for the next financial year. And most councils are now getting over £1 million to support this transformation. I think it means we have before us a really golden opportunity to make sound and strategic decisions that will put personalised care on a surer footing for the long term. I do think it's up to us to seize this moment and to deliver the promise that's in putting people first. What I think is encouraging is that we are going to be building on some firm foundations, thanks very much to the hard work you've already been doing over the last 12 months. It's quite interesting, today's Community Care Readers Survey gives us quite a welcome snapshot of progress, and it will come ahead of a full evaluation that ADAS are publishing later this year. I think there's plenty of food for thought from the community care finding. I think it's encouraging, for example, that just under a quarter of councils have made considerable progress towards a fully integrated personalisation strategy. That advice and advocacy services are rated good for helpfulness and accessibility in most areas, and that in about half of cases people are using personal budgets to buy different types of support rather than selecting the same kind of support as before. And I think that chimes with what I've heard, what I've seen around the country. And the stories of real progress across 4 key dimensions of personalisation: in better prevention and early intervention, in building more choice and control, in improving universal services, and in creating greater social capital and community-based support. I think preventative programmes, the POPs programmes you'll be aware of, partnership for the people projects, are terrific in terms of improving lives. They are certainly cutting the long-term costs by targeting older people at risk of falls, for example, and the re-ablement programmes some of you have been involved with. I mean, in the best areas, we've seen half of those entering these schemes, typically after a bereavement or a serious illness, ending up not needing any social care support in the immediate future. And some councils are now thinking of extending their help to help those with high care needs move actually to lower level care, including care in their own homes, and they're doing that through structured, person-centred planning. I think it shows that these are all areas that are really ripe for expansion and for replication across councils throughout the country. Added to all of that, I want to mention the good work that's underway on information advice. I just want to say I was particularly struck by the work that Age Concern are doing in this area. But I do recognise, I think we've got some way to go in helping to build people's awareness and confidence about making personalisation work for them. I think that's another point that came out of the community care survey. I think there's some particularly exciting work underway thinking beyond specialist care services and looking actually how we help people reconnect with mainstream services. I've just come back from a meeting with other ministers and people with disabilities and life chances. We had a ministerial group and we were looking at transport as a particularly important part of what we need to do to help people connect up and access services. In Herefordshire, for example, we've seen people investing in village halls to make sure that they're all accessible for older people and with disabilities. Literally and figuratively opening doors for people who want to choose to use mainstream services as part of their ongoing care. It does mean that older people who want some company, and I was really struck by what you were saying about what people are doing in choosing services, and they do want to get together, they do want to have an enjoyable time. Well, yeah, that's like all of us. That's what we all want. But then people can connect with their local community. They can enjoy mainstream local services in the village hall rather than having to travel miles by bus to a day centre. They can have that on their doorstep. And that really strikes at one of the key points that I want to make today. I think putting people first, we've all signed up to it. I know we're all really behind it. I just want to say that isn't just a vision for social care. I actually think it's a vision for care across the whole of society. Now, I know it's a subtle difference, but I think it's an important one, because I think it speaks of the need to broaden the debate that we're having. I think we need to demand that all parts of the local government machine step back and ask themselves some fundamental questions about the types of communities they want to build. I remember my first meeting with Margaret Easton from the LGA when I got appointed in this job. We spent a lot of time talking about gritting. Why do we talk about gritting? Because if the roads aren't safe, we can make homes safe, people go outside and fall over in the ice, then we haven't achieved very much. How do we get the whole council to work together, all the different parts of it, to deal with this? And I think the local authorities, local government, should be asking really open-ended, tough questions. Is it good to grow old around here? That's a challenging question. Ask that question to some older people, and what answers do you get, and what do we need to do to change that? Is it good to be a wheelchair user here? And what can we do, not just in social care, but in health, in housing, in transport, in education, to make it better? So I'm trying to say that principles about putting people first, I think that will sound out not just across the social care field, but far beyond it. We need to be fully integrated into a council's thinking as a whole. We need to resonate across the local government. I would like putting people first to act as a bit of a rallying cry for the full range of statutory, private and third sector services to get right behind. And I appreciate actually doing that, bringing people together, getting everybody on board, getting them running in the same direction does take a bit of time, and you do put yourself in a room with people to end up having some arguments. Well, good. I think that's what it's all about. Let's challenge and support each other to achieve that change, because I think it can be done. And it's interesting, some areas of the country are making big breakthroughs, others, though, are languishing behind. And for those of you that I describe as being ahead of the curve, we need you to carry on, leading the way, push the agenda forward, prove to the business what can be achieved, give us the practical examples of what you do on the ground. For those councils who are behind the pace, then we need you to spring into action. We need you to step up to the plate and say, yeah, let's make this happen in our area as well. And how do we achieve this? Well, I think there are just 4 areas I want to emphasise. And the first has got to be leadership. Strong local leadership is critical to all of this. I have to say, personalisation is something I can believe in, but it's something we can't prescribe from Whitehall. The whole point is that the inspiration is local, that the inception is local, that the delivery of personalisation is local. So that's the first thing I want to say. We need you to take the lead, to drive the change within your area. Make those connections, build the partnerships, work with people in your communities. Those who use services, indeed those who may want to use the services in the future. Let's break down the barriers to reform. And you're not on your own. I mean, putting people first was developed as a partnership between local and central government. We want that strong relationship to last. And I particularly welcomed the appointment of Jeff Jerome as the National League for Transformation within the LGA. He's helping us to make the connections between Whitehall and local councils that will give you the support, give you the tools that you need to drive the agenda forward. And we'll continue listening. We'll continue to respond to what you tell us that you need to accelerate progress in your areas. And equally, as we're hearing today, there's an awful lot you can learn from each other. And I think that was another interesting feature of the community care research. A fifth of respondents said that better sharing of what works between councils would help make personalisation happen successfully in their areas. And we now have the new Deputy Regional Directors working with the Joint Improvement Partnerships to provide that advice, that support, and yes, the challenge too, so that local leaders can draw upon that to make things happen in their areas. The second area is that of integration and partnership working. And it's quite clear to me, and I'm not sure it's for you, but the particular relationship between health and social care is vital. Where there's good join-up, and Croydon, I have to say, is a good example, prime example, which I've seen great results, particularly for other people. The preventative work, particularly the POPs programme I mentioned earlier, I think proves this point. So let's see strong leadership across both areas. Let's have more effective collaboration at the top table, where things like local area agreements, things like joint strategic needs assessments really can help. And let's move away from a them and us culture on funding. I think if it makes good sense to pool funding between health and social care, then that's what should happen. And let's see that carry through to more effective partnership working on the front line. Nutritionists, therapists, physiotherapists, for instance. I mean, they routinely work hand in glove with social care colleagues, and all these are vital to better services and better outcomes. If you think about that person, their needs, they're going to be drawing upon all those individual professionals, but let's join it up so that individual gets that seamless service. I think it's in all our interest to forge stronger connections at a local level. The third priority I want to leave you with is innovation. We do need councils to harness the genius, the expertise, the creativity that the third sector can provide. I used to be Minister for the third sector, as many of you will know, and I've seen firsthand what, at its best, the third sector can do really well. And I think that this reform can act as a bit of a catalyst for market renewal, a spur for new services and social enterprises to rise up and fill gaps in the market. I was at a dinner the other night with some people providing domiciliary care, and I was extolling the virtues of social enterprises, and one provider, who I won't name, said, social enterprises, they're overblown, overspoken, overstated. And then, like a bullet out inside the room, a guy on Somerset Care, you may know this, which is a large social enterprise, just devastated him with this kind of description of what he's doing, how it's working, the difference it's making in his community. So we know that we can release energy and expertise and enthusiasm out there through social enterprises, and we've just been hearing some great examples just now. And what I like about this, I think, is because I think people genuinely want to spend their budgets on things that we haven't invented yet. I think that we don't know what we don't know, but they will. They'll find it out. They'll know what they want, like we all do as individual people. None of those what I'm going to go for shopping for at the weekend. Don't know myself yet, but I'll be out there and I'll be doing things, and that's what everyone wants to do. It's just like normal living, and I think that's fantastic. We've got a system that allows people to do, I call it normal living, and to be creating, demanding, and getting new and different kinds of services. There's a great business in London, for example, that's been set up to deliver Asian Meals on Wheels for local residents. In Barking, which I went to see, mental health service users there, they come together, they pooled all of their individual budgets, and they're commissioning services collectively. I like that, pooling individual budgets. Great. I don't think there's limits to what people can and should do with their resources. And lastly, let's never forget, personalisation is about people, not just about process. I know we all run it, I've talked about structures, I've talked about processes, but it's about people. I just want to say, I know some people out there revel in the idea of talking about a broken society. I just think it's demeaning, frankly, and wrong to talk about a broken Britain, because I get out and about, I see strong communities, I see supportive families, I see resilient individuals getting through their lives. I also see, I used to be Minister for Volunteering, I see volunteers, I used to run volunteer projects when I was young. I see volunteers, I see carers, I see community groups, playing a massive part in this collaborative, collective endeavour to sustain a society that we're all proud to belong to. But I think we can go further with that. And I was working on issues around user involvement way back in the 1980s as a youth and community worker and as a consultant. And I think the only way we really harness the true benefits of personalisation is if we genuinely put people at the heart of the reform at every stage and everywhere we can. Now, I don't like this horrible jargon, but co-production is the word that we're all beginning to get to use. I think it's a fundamental part of the jigsaw. We need to generate this sense of double devolution, bringing the individual insight, the human imprint, at all stages of development. Planning, the commissioning, design, the delivery, it needs to be there. And putting people first isn't just about offering people some sort of choice at the end of the whole chain of delivery. It's about input right at the front end as much as it is about output at the other end. We need to give people the genuine power to influence change at every stage in the process. Because what that does, we all see it when we do it, and we're all kind of a bit reluctant, but then we get on with it and go, wow, is it's really powerful. I think at a stroke, if you can get that right, it destroys the old binary relationship between an individual and his set of services, and a kind of get people into a whinging and then other people into a defensive kind of mentality. If you get out of that entirely when we engage people in that way, it turns people into passive, it turns into people into active participants in their own care, not just passive recipients of that care. And I think in the past, yeah, we tended to do things to people rather than do things with them and for them. As the excellent paper that SCIE and Queen Mary University are publishing today puts it, the old system saw care professionals as, quoting, fixers who focused on problems. And I think that's a phrase which makes care workers sound like plumbers, suggesting that people, they serve our leaky taps rather than human beings. And, co-production changes all of that. It makes the system more efficient, it makes the system more effective, and crucially, more responsive to community needs. And frankly, I think it makes social care altogether more humane, more trustworthy, more valued, and actually more transforming for those who use it. More transforming for that guy with his wicked dog, more transforming for the 6 million carers, more transforming for the 20 million volunteers, that huge source of untapped social capital and community renewal. And I have to say, I hope, more transforming for the workforce of today, the care users of tomorrow, who we need to engage now to prepare services for the future. I think there's huge consensus on this point. I believe there's real commitment to make it happen. The great thing now is we can. It's within our grasp. The advice, the tools, the resources, the money, it's all there to make it happen. So I want to end by just saying, let's press ahead. Let's build on the great work that's underway. Let's make what works in one area work in every area. Let's make sure putting people first takes real shape, real tangible, not just in some areas, but everywhere, not just partially, but completely. That's our challenge. That's my job. I'm looking forward to working with you to make it happen. Thank you very much.